Negative pressure rooms are a type of hospital room that keeps patients with infectious illnesses, or patients who are susceptible to infections from others, away from other patients, visitors, and health.
As can be seen on the diagram, this is one of the example floor plan of a negative pressure room. They are called negative pressure rooms because the air pressure inside the room is lower than the air pressure outside of the room. This means that when the door is open, potentially contaminated air or other dangerous particles from inside the room will not flow outside into non-contaminated areas. Instead, non-contaminated filtered air will flow into the negative pressure room. Outside of the negative pressure room, there is a smaller room which called as anteroom. Anterooms will maintain patient and staff safety in the face of infectious disease. Electronic monitors placed in the isolation room and the areas outside of the room do offer continuous monitoring of the room pressure. They are equipped with an alarm that will sound if the room becomes incorrectly pressurized. According to the guideline from Ministry of Health, there are two approaches on where the air diffuser and exhaust return air grill shall be located. The first approach is that the ceiling-mounted air diffuser shall be located at the center of the room or slightly towards the entrance, while the return exhaust grill is wall-mounted at a low level above the patient bed head. This arrangement maximizes the room air mixing and contaminant removal. However, the supply diffuser shall be carefully selected and located such that the air throw does not induce bedroom air to enter the anteroom. The second approach is that the ceiling-mounted air diffuser shall be located at center of the room or slightly towards the entrance, while the return exhaust grill is to be ceiling-mounted over the patient bed head. The first approach shall be the better arrangement. The above arrangement of the air diffuser and grill shall ensure that the air is moving downward from the air diffuser to a clean area where health workers and visitors are likely to be and across to be infected patient into the exhaust grill. Cleaning the air by using high-efficiency particulate air HEPA filtration. HEPA filters must provide a minimum removal efficiency of 99.97% of particles. It can be used to supplement other recommended ventilation measures and as an adjunct to other ventilation measures. HEPA filters may be freestanding, portable room air recirculation unit, or may be permanently attached to floors or ceilings to minimize tampering. In selecting the HEPA filters for an individual room without central ventilation system, consideration should be given to the size of the room, air changes per hour (ACH), and time required to remove the airborne contaminant. Minimum air exchange rate is 6 air changes per hour and maximum is 12 air changes per hour.
The key factors affecting HEPA functions are fiber diameter, filter thickness, and phase velocity. The air space between HEPA filter fibers is typically much greater than 0.3 m. Unlike sieves or membrane filters, where particles smaller than openings or pores can pass through, HEPA filters are designed to target a range of particle sizes. These particles are trapped, they stick to a fiber, through a combination of the following three mechanisms. Diffusion. An enhancing mechanism that is a result of the collision with gas molecules by the smallest particles, especially those below 0.1 m in diameter, which are thereby impeded and delayed in their path through the filter. This behavior is similar to Brownian motion and raises the probability that a particle will be stopped by either interception or impaction. This mechanism becomes dominant at lower airflow. Interception. Particles following a line of flow in the airstream come within one radius of a fiber and adhere to it. Impaction. Larger particles are unable to avoid fibers by following the curving contours of the airstream and are forced to embed in one of them directly. This effect increases with diminishing fiber separation and higher airflow velocity.